In this video, we will see how aging unfolds and how the place a city resident lives in may affect the process. To understand how places affect the conditions of aging, we must first understand what aging is. Our functional capacity increases in childhood and peaks in early adulthood and then decreases. Physiological aging causes a slow but continuous physical and cognitive decline. However, the level of decline is largely determined by factors related to lifestyles such as smoking, alcohol consumption, physical activity and diet, as well as environmental factors. Interventions that create supportive environments and foster healthy choices at all stages of life can decelerate the decline and lower the disability threshold. The conditions of the residential environment affect our physical and mental health. The urban place where we live can promote or limit our physical activity and mobility, our contact with nature, our diet, and our social interactions. For example, parks and green spaces can promote well-being through increased activity levels. The place itself and the way we feel about it is reflected in our behaviors, in our choices, and in the way we are exposed to environmental risk factors, as for example, air pollution. One of the best and widely used frameworks to show how we interact with our environment and how it shapes our health and well-being is the health map. This framework was developed by Hugh Barton and Marcus Grant in 2006, and it is based on the previous work of Dahlgren and Whitehead, known as the model of the main determinants of health. Let us hear from Marcus Grant specific examples of how we can use this framework.
So this then is the model. This is the health map, which you might well be familiar with, where we've got the people at the center here. And then around that, you've got their lifestyle, economy, and then we've got the dark blue, which is all the interventions where we're making interventions as architects, as designers, as planners, urban designers, landscape architects in the built environment. And of course, the whole thing is wrapped around the global ecosystem that holds our health too. So if we make an intervention in this dark area, you can see then that's an intervention. It might be in streets and roads. And you can capture those primary health impact that it has on people, directly on people, on the way they move, their ability to move. Maybe there's air quality impacts on their health. You also have then an impact on the planetary system, on planetary health. So it might be by putting in the road, you've had to remove trees, for instance, just as an example. So there's interactions there immediately that you can capture, like a health impact assessment on that health map. Those are primary effects, primary impacts on people's health. There's also secondary impacts, and I'll give you an example in a minute. And you can also pick up tertiary impacts. So this is a fantastic tool for looking at all those impacts for any one intervention, proposed intervention. Hopefully it hasn't already happened in the built environment, where we want to make a decision and where we want to capture and maybe mitigate the adverse impacts on health and promote the positive impacts on health. I want to focus on the work we're doing here in Bristol on aging. We've got a very powerful organization in Bristol here called Bristol Aging Better, which is sort of alliance of many different groups. And we've also, through an organization that I'm working with, have set up something called the Bristol Walking Alliance. Now, walking is something that's accessible across the age span. You don't need particular equipment, just walking out your front door, walking to the shops, walking to meet someone, walking to the park. So we focus a lot on Bristol in terms of health on the walking environment. And we've given people cameras and followed them and gone out on walks, local walks in different areas with older people, looking at their experience of the environment. Bristol is a very hilly city. So sometimes to walk to a park or the shops, you're faced with quite a hill and there's nowhere to rest. There's no seating. So then by talking to the older people, we can find out where the city council could put in seating, where they might need to put in lighting, where there's trip hazards on the pavement. And so small investments, making the outdoor environment more and more healthy for older people. And the big study has shown that the biggest indicator for older people not requiring visits to the doctor and not requiring a lot of healthcare support is the number of times that they go out of their front door and walk in the local environment. And if people are walking at least 2 days a week or going out 2 times a week or more, that's an indicator of needing health services a lot less. So whatever we can do to make the walking environments, the local environments more walkable for old people is very good for health.
Over the last decade, there has been a wide range of initiatives implemented by municipalities, communities, and organizations worldwide towards becoming more age-friendly. Currently, more than 1,000 cities and communities from 44 countries integrate the WHO Global Network for Age-Friendly Cities and Communities. These cities are committed to improve their physical and social environments to become better places to grow old. The majority of projects involve the transformation of the built environment and adaptation of structures and services to the needs of aging populations. The WHO defines an age-friendly city as an equitable, inclusive, safe, and supportive place where policies, services, settings, and structures related to the physical and social environment are designed to support and enable people to thrive and achieve the highest possible level of health and well-being, regardless of their age. It is a place that helps people to stay healthy and active, preventing or delaying the disease and functional decline, even at the oldest ages. It is a place that provides accessible and barrier-free public spaces and buildings. It provides affordable housing and good transportation options, enabling people to stay active and independent, to participate in social life, and to access services. It delivers people-centered services and appropriate social support to those in a vulnerable situation. The WHO identifies 8 dimensions for policy action to create age-friendly cities and communities. The first 3 domains focus on the physical environment features as outdoor amenities, as public spaces and buildings, transport and mobility, and housing. The second cluster of domains covers the social dimensions related with social participation, social inclusion and non-discrimination, and civic engagement and employment. The final group brings together 2 domains that address how local government services can contribute to supportive places. They are communication and information across sectors and the provision of community and health services. This checklist, together with an age-friendly environment assessment tool, can be used as point of reference for local policymakers. In this process, it is critical to hear the voices of the older people and consider their perspectives and concerns about the place where they live. Now think about your place of residence. Do you consider the place where you live as an age-friendly place? Would you like to grow old in the same place where you live now? Would your emotional bonds to your place, what we call place attachment, influence your desire to grow old there? There are many tools and metrics available to assess urban places and how age-friendly they are. Here we present 2 examples of conceptual and methodological frameworks that you can use and adapt when conducting a place-based evaluation. One example is the Place Diagram tool developed by the Project for Public Spaces, an American non-profit organization dedicated to community-led urban design and placemaking since the 70s. This diagram captures 4 key urban qualities: sociability, uses and activities, access and linkages, and comfort and image. Imagine that the center circle on the diagram is a specific place that you know. It could be a neighborhood, a street, or a public park. You can evaluate that place according to these 4 urban qualities. These main criteria correspond to a number of intuitive or qualitative aspects by which it is possible to assess a place. The next outer ring shows the quantitative aspects that can be measured by statistics and specific indicators. This approach has been used around the world to inform different types of urban interventions. Examples range from the iconic public space transformation of Times Square in New York in 2007 to the process of community revitalization in eastern countries like Serbia and Croatia in the aftermath of civil war in 2003, or to the urban regeneration of an informal settlement in Bogota in Colombia in 2019. Another well-known place-based assessment tool is Place Standard, a process evaluation jointly created by the National Health Service of Scottish Government and the Public Body of Architecture and Design of Scotland. The main purpose of this tool is to maximize the potential of the urban environment to support health and well-being. The tool asks 14 questions about the physical elements of a place, for example, its buildings, spaces, and transport options, as well as the social aspects, for example, whether people feel socially connected and if they have a say in decision-making. Questions relate to topics that are plotted in a diagram, and participants answer by scoring each topic from 1 to 7, where 1 means there is a lot of room for improvement and 7 means there is very little room for improvement. For example, in the city of Coimbra in Portugal, this tool was used in an urban health workshop with municipal technicians from different city departments to inform future urban interventions aiming to improve the quality of public space and mobility conditions in different neighborhoods of the city. Participants benefited from a site visit and engaged in group discussions to identify local needs and share different perspectives and perceptions. In the end, results were plotted in a diagram, highlighting for each neighborhood the aspects that need to be improved. These tools are useful for their ability to create structured discussions around the complexity involving the relationships between urban environment and health, providing local people, decision makers, and other actors a common framework to assess physical, built, and social elements of a place.